So I'm going to be talking about infectious disease today. Our program, the IPAC hub, and the staff. Just going to give you a brief overview of our program, an IGAS update, which is invasive group A strep, some challenges we're seeing, and then any questions afterwards. So this is our infectious disease team. It's made up of one program specialist, four nurses, and one program assistant. So one additional nurse is currently on mat leave, and they are located in Dryden, Ear Falls, and Kenora. And they cover regionally for the area for infectious disease. So a small but mighty team. And then the IPAC hub team is located in Kenora and Red Lake. One of the health educators in Red Lake, Maggie Mao, the health educator, she is split between the CDP program and IPAC Hub. And Julie Slack, CDP manager, manages her. I currently have two other people that report to me, and they are in the VPD or Vaccine Preventable Disease program. So the infectious disease team follows up reportable diseases for the region in collaboration with sexual health and environmental health. There's some crossover there. Follow-up entails that the person is no longer infectious and receives the appropriate treatment promptly. We initiate contact tracing if it's necessary. Not all diseases have to have contact tracing, but we determine whether anyone else may be at risk for the disease or spread the disease. We also collect information about health history, risk factors and outcome, and we also complete health education with the client. We do input appropriate information into the database. So we have two databases for our program, IFIS, which is the Integrated Public Health Information System, and CCM, that's where our COVID-19 cases are currently in that database, and that's case and contact management. So we input that data into the database at the ministry level for surveillance purposes and data tracking. So in this chart, I know you can't see it, but these are all the diseases of public health significance that are reportable to the medical officer of health under the Health Promotion and Protection Act. The diseases in bold are immediately reportable. So some examples of those diseases in bold would be things like measles, invasive meningitis, invasive group A strep that I'm going to talk about a little bit later. And after hours support is available 24/7. And also in this chart, so the diseases are grouped by categories. So zoonotic, enteric. So respiratory, sexually transmitted infections, bloodborne infections, and VPD or vaccine preventable diseases. This is just a snapshot of the diseases we've seen. So I compared 2018 to 2023, and this data was extracted from IFIS on December 27th for the 2023 year. So you can see how our cases have changed. Blastomycosis, you can see our numbers have increased with testing. Chickenpox, relatively the same. COVID-19 and influenza, I just wanted to note here that we no longer do individual case follow-up for those diseases. What we do is, excuse me, is we look for any linkages to long-term care homes or hospitals where there may be outbreaks. So we do surveillance on that. And I'll talk about that a little bit later about the outbreaks. Food and waterborne illnesses. So those infections, what's lumped in there is Giardia, Campylobacter, food poisoning, and Salmonella. Invasive bacterial infections, that's relatively the same as well from during those years. That would include things like IGAS or invasive group A strep, Streptococcus pneumonia, which is also invasive, um, and meningitis and Haemophilus influenzae. Lyme disease. So it's important to note here, you can see we had 6 cases of Lyme's, confirmed cases in 2018. 2023, we had 0 cases. That doesn't mean that we don't have any here. It's just that physicians, instead of testing, they're automatically treating the cases right away. And that's the recommendation for Lyme's now. So we are still seeing Lyme's in the area. It's just that they're not testing. And TB. So here we have active TB and then latent TB or TB infection. So relatively the same for latent TB. We'll just move on to outbreaks now. So we also support facilities with outbreaks. So usually the facility will notify the health unit when there are residents or patients who have gastrointestinal or respiratory illness. Um, the staff and the residents have to be connected. The staff and residents connected to the outbreak have to have acquired the agent from that facility. So the IDPHN, so the nurses do work with the health inspectors to support facilities when there is an outbreak. Meetings are held daily with the facility until the outbreak is ongoing and stable. And then usually it's every 2 or 3 days until the outbreak is declared over. And the outbreak can be declared over when there's no more cases of infection in either the residents or staff, and it's during a specified time. So that is really dependent on the organism, on what caused the outbreak. And the ministry is aware of outbreaks when the data is entered into those databases that I talked about earlier. So all of that information, it's really timely. We have to get it in there and keep it updated as the outbreak is ongoing. This is just a snapshot of outbreaks. Again, I compared to 2018 to 2023. And again, this data was extracted December 27th, so it's not for the full year. So you can see that the number of outbreaks for the infectious disease team and the environmental health team, which is the health inspectors, has increased substantially. So here we had 9 outbreaks, and for 2023, we've had 34. So a lot more work going into the outbreaks, and they are very timely. Oops, I skipped over one. Okay, sorry. IPAC Hub. So the IPAC Hub provides support to staff working in the long-term care homes and congregate living settings. They host communities of practice regularly to support information sharing, learning, and networking to those settings. They also provide recommendations to strengthen IPAC programs, so that's infection prevention and control. Things like hand washing, how to prevent infections, donning and doffing of PPE, personal protective equipment. They also provide one-on-one support as requested. And they did deliver fall preparedness sessions to long-term care homes and congregate living settings across the region. This took place in September and October of 2023, and the presentations were held in Sioux Lookout, Kenora, Fort Frances, Dryden, and Red Lake. So those did go very well, and I'll just I'll let you know the numbers in a little bit here. So the IPAC Hub for 2023, so they held 11 community of practice meetings. 200 people were in attendance. There were 401 interactions with congregate living settings and long-term care homes. So that also included in-person and virtual. They did 6 IPAC training sessions with 73 participants. So that included review of personal protective equipment, hand hygiene, reviewing the chain of infection. And again, the 5 presentations held for fall preparedness, where 16 participants from congregate living settings and long-term care homes from around the region participated. So at that time, a respiratory information package was given, and they had the opportunity to sit and discuss. The nurses and health inspectors also participated in the long-term care home session. So it was a very good review for everyone. This is just some pictures of education done in the region. So you can see here, so these are 2 of our nurses. In the top left is Jessica and Chelsea, and one of our health educators, Gary, and they're getting ready. They're just doing some prep to go out to do some training with a partner. So here Jessica is shining the light. She would have had a spray bottle with glow germ in it, and she would have pretended that the mannequin would have coughed and sprayed germs, pretend germs on the healthcare workers. So she's just flashing a light. She just has a light there showing the germs that landed on Chelsea and Gary's gloves and on their gowns and also on the tray of the client. Kenna is in the middle. That is one of our nurses who is currently on mat leave. She is doing some training at Rainy Crest with the healthcare workers. And again, she's presenting some scenarios and what kind of PPE healthcare workers should be wearing. And then at the top right is a display done in Kenora with the mannequin. So I'm just going to move on to Group A streptococcus, or IGAS for short. And what is it? So Group A strep is a bacteria that can be found in the nose, throat, and skin of healthy people. It can cause mild illness such as impetigo or strep throat. Gas can become invasive when it is found in places that are normally sterile. So it shouldn't be found in the blood, fluid surrounding the brain or lungs. That is not normal. And that's where it can cause invasive disease. It can be invasive if it causes severe infections, such as necrotizing fasciitis, so that is flesh-eating disease, myositis, meningitis, or streptococcal toxic shock syndrome. IGAS is associated with underlying risk factors such as cancer, heart disease, diabetes, lung disease, alcohol abuse, skin breakdown, which includes cuts, wounds, chickenpox, scars, people who use injection drugs, postpartum, and post-surgical patients and the elderly. So I will discuss the risk factors for our health unit catchment area in the following slides. Recently in Ontario, there has been an increase in children with IGRAS. We have not seen that increase in our catchment area. Most of our cases are adults 25 and up. But across Ontario and actually across Canada, they are seeing children with IGAS. So back in 2017, we've always had IGAS, but back in 2017, we did see a spike in cases and there were 65 cases. So this prompted There was a working group put together and we created an enhanced intake tool to capture better risk factor data and exposure information. So that exposure information is where the case could have acquired, I guess. Since 2017, there has been ongoing communications with healthcare providers. We do enhanced surveillance, IPAC investigations of institutions, and distribution of wound care kits to vulnerable populations. So normally, on an average, we see about 50 cases a year now. So you can see in 2018, there were 50 cases. This year, and we saw 43 cases, and that was for the whole year. So we are just hovering around that same roughly 50 cases. And Northwestern Health Unit has reported the highest monthly rates of IGAS in Ontario. So we continue to be higher for IGAS related to other parts of Ontario, along with other Northern Ontario health units, including Thunder Bay, Porcupine, Algoma also sees higher rates.
I see Bob has his hand up.
Okay, hi. Sorry, I can't see anyone. Bob, did you have a question?
Yeah, thanks, Wendy. No problem. Can we ask questions, or would you rather have them at the end? Or I don't want to.
No, I don't mind during.
Oh, I was just wondering what the for the high number of the eye gas infections. What is there a correlation between excuse me, intravenous drug use?
Yes.
You mentioned there is, right? Okay, because
Yes.
I know just like anecdotally or personally, I've been involved in several postmortems where that was the outstanding factor, I guess you'd say, and also chronic alcohol abuse. So I just that's a fair statement that that's a correlation.
Yes. Yeah, it is one of the risk factors, and yeah, so I'll just go back here. Yeah, so at the bottom of that slide, it breaks down who's at increased risk for invasive group A strep, and definitely, yeah, alcohol abuse, injection drugs, any kind of chronic illness, especially the young and the old are also susceptible as well. But it could affect anyone, right? But usually healthy people they respond, their outcomes are better than if you had a chronic illness or underlying conditions. Does that answer your question, Bob? Okay. Yeah, so you can see here that, and this is taken from an IGAS report created by PHO, Public Health Ontario. So this was for an IGAS season, and an IGAS season goes from October, this current slide goes from October 1st, 2022 to September 30th, 2023. It was published on October 12th, this document. So you can see that we are the highest for Ontario for this time period, and we consistently have reported high rates of confirmed IGAS in Ontario. So these are some risk factors for 2023 for IGAS. You can see how all of these risk factors are related to social determinants of health. So we have the higher IGAS rates due to the higher risk factor rates, such as chronic illness, wounds, dermatological conditions, substance misuse, and injection drug use. So at the top, you can see we have some unknown risk factor data, and that means that we did not receive any information on that client for risk factor data. And it's more likely we didn't receive that from First Nation partners. Sometimes First Nation partners will just put the treatment for the client, but they won't necessarily put risk factors. So Under that, you can see chronic illness is definitely the highest here, followed by diabetes, wounds or skin conditions, alcohol abuse, injection drug use, homeless, underhoused, pregnancy, postpartum, immunocompromised, recent non-invasive strep infection, or HIV. So that was extracted for our 2023 year. So actions taken by us. So 100% of cases are followed up within 24 hours. We do connect with the case themselves, the healthcare provider and or the ICP at the hospital, the infection care or infection control nurse at the hospital. If they are on First Nation, then a referral is made to Indigenous Services Canada or the appropriate First Nation organization to follow that up. We do continued surveillance of IGAS. So what that means is we're continually monitoring it, right? Dorian, our epi person, he does dashboards. So we're always looking at our cases, looking for clusters. A target for, I guess, would be that we wouldn't see a significant increase of cases in our jurisdiction. We also look at M types. So M types are subtypes of IGAS, similar to how COVID-19 has variants. There are M types of group A strep. So we're looking for any kind of clusters of M types in communities or new M types that appear. Currently, I did talk about the increase of children under 18 acquiring IGAS. So, for example, in 2022 and 2023, for the months of October to December, there were 30 and 74 cases respectively in Ontario. So more than double from the previous year in 2022. So that's the increase of cases they're seeing in kids. And again, we're not seeing that here in our area. We had one child under the age of 1 in 2022 and one case less than 1 in 2023 who both recovered. So we do, again, report to the ministry via IFIS through the database. And a health advisory was sent to our healthcare partners in mid-November to make aware of the increase in our area and make sure they're doing prompt assessment, treatment, and remaining alert for signs and symptoms of IGAS. Another alert will go out I think today, just in regards to IGAS as well, just a reminder for healthcare providers as well. So you'll see that come out today as well. There will be a media release. Challenges and next steps. So right now we're not sure if the IPAC Hub funding will be going forward next year. Current funding is until March 31st. So that's, yeah, just unsure, right, with the program where that's going to go. Staff turnover and recruitment. So our IPAC Hub consists of a position of a health promoter. She just resigned actually this week, so that is vacant. And one of our health educators will be doing her practicum for PHI for health inspector designation. So those two positions will be vacant. We won't post those positions because they're contract and uncertain if the IPAC Hub will continue beyond March. And in regards to our nursing, we are a little bit short as well. We have a full-time contract position open in Kenora and a full-time mat leave in Fort Frances to fill. Right now, we have one of our infectious disease nurses in Fort Frances. She's being borrowed to the vaccine preventable disease program because they are very short of nurses too in the south end here in Fort Frances, Rainy River, Atikokan area. So those are some challenges. We continue to build really good relationships with our partners since COVID. So that is ongoing, and we're trying to create better relationships with partners. So I believe that is the end of my presentation.